In this video, we'll be talking about fertility, difficulty conceiving, and also the opposite end of the spectrum in terms of birth control to reduce the chance of getting pregnant. So fertility issues sometimes are framed as more of a female problem, but that's completely incorrect. Males and females are both approximately equally affected by fertility issues. There are a number of reasons. Some of them are scarring within the tubes that transport, the ducts that transport the gametes along. Other ones are damage due to the actual gonads themselves, due to infection, scarring. For males, heat, being too warm for the development of sperm. And there could be other problems with, say, the sperm themselves not being able to swim properly. There could be problems with the uterus not being able to successfully allow implantation to occur. So many, many different reasons. Regardless, approximately 15% of couples are considered to be infertile. And the definition of being infertile is that after a year of trying regularly, they're not able to get pregnant with a child. So it's a pretty significant number. So as I mentioned, there's many possible causes and lots of possible solutions. One of the best ones I can think of is adoption. There are a lot of kids out there that really need a loving home, and adoption is a great option for many people. However, some individuals are insistent on having biological children, and I can understand, the desire for that. And so we'll talk about, for those individuals who are infertile and want their own biological children, possible solutions that they could explore if they want to. So collectively, these are called assisted reproductive technologies, or ARTs for short. And these include doing techniques outside of the body involving the gametes, sperm and the egg, and then the embryo that results to help a couple get pregnant. So the main process, the one that we'll focus on, the traditional one, is called in vitro fertilization. In vitro, this word, or this phrase I should say, it's a Latin phrase. It translates to in glass. So if you've ever heard about test tube babies, that's what they're talking about, babies that were born by in vitro fertilization. The way that this process works is that a hormone treatment is given to a woman so that she has multiple eggs, more than the usual, that are going to be maturing inside of that ovary. And then those eggs are extracted directly from the ovaries. Sperm is collected from a male, and they're mixed outside the body, allowing fertilization to happen, allowing embryos then to form. And then some of those embryos are implanted. They're put back up into the uterus. On average, 1 of every 3 embryos, those letters reversed there, embryos implant. So when doctors are doing this procedure, they're advised to put between 1 to 3 embryos up inside the uterus. Some doctors, however, do not follow those guidelines. You may have heard of Octomom. This was a long time ago now. She was the very first woman to give birth to octuplets, 8 babies all at once. Of course, they were delivered by C-section. Each of the babies at the time of delivery was a pound or less. Amazingly, due to modern technology, they were all able to survive. But she really beat the odds. Were all 8 of them implanted, the doctor put in there. But usually between 1 to 3, so you don't want to put in more than 3 typically. So let's talk about the other end of things now, birth control, trying to prevent pregnancy from occurring. So to introduce this topic, we have Dwight Schrute again from The Office. And I'm going to introduce this video to you, talking a little bit about this scene. So in this scene, Dwight had been involved with this woman named Angela, who also worked in the accounting department. And they had come to this agreement through a strange set of circumstances to attempt to procreate 5 times. They had a contract where they were going to have intercourse, 5 times. And Dwight's having second thoughts about it. He's not really happy about it, but he has a contract he has to follow.
I am an honorable man, and I will honor the contract. but I don't have to give her the good stuff. Shroot's sperm are strong. They're no match for a grown Shroot man. Let's see what she gets.
So one thing from that video I want to point out is a common misconception. Microwaves actually don't release harmful radiation. It wouldn't cause any problems. That's a complete misconception. So how does birth control actually work? Well, birth control methods can work in one of these three ways or a combination of these ways by preventing ovulation. Remember, ovulation is the release of an egg from the ovary. Can prevent fertilization, egg and sperm uniting, prevent that from happening. Or prevent implantation, embryo attaching to the wall of the uterus, the endometrium. So let's first talk about methods that prevent ovulation, prevent the egg from ever being released. These are going to be hormone-based methods, all of them, all hormone-based. The most common one we probably think about is birth control pills, where pills are taken containing hormones that prevent the signals that cause an egg to develop and to be released. We also have implants. Some implants you can see here can be done just under the skin, a lot of times in the arm. Injections like this Depo-Provera that can be given every so often to also have those hormones prevent ovulation. You have patches that can be put on the body, and then those hormones go through the skin into the bloodstream. The vaginal ring, which a woman can put into her vagina herself. It can be taken out whenever she wants, and just make sure she puts it back up there afterwards to prevent pregnancy. It also releases hormones. And one that's not listed here is a hormone-based IUD. So write that up here, hormone. IUD. IUD stands for an intrauterine, inside the uterus, device. Unlike the vaginal ring, which a woman can put herself up into her vagina, the intrauterine device, is kind of T-shaped thing that we'll see in a future part here, that has to be put up by a doctor. This is going further up into the uterus, which a woman cannot access herself. And there's two different types of IUDs. One's copper-based, one's hormone-based. The hormone-based ones will prevent ovulation. You'll notice that these methods up here, these hormone-based methods, are highly successful. The 99% would be with like perfect use. Lower percentage is if you forget, or something you take like a prescription drug interferes with your birth control pill and you don't realize that, you gain a lot of weight, you don't get a new prescription, a variety of things, but highly effective overall. There's not a lot of human error possibilities involved here. And another thing I want to point out is that all these hormone-based methods do carry some risks because especially for smokers, it's been shown that these hormone-based methods increase the chance of stroke later on in life. Some women experience weight gain associated with these methods. That's not the majority, but some do. And with the IUDs, we'll talk about how in some cases those can burrow into the lining of the uterus and lead to serious complications. It's rare, but it can happen. On the flip side, for women who have very severe periods and severe symptoms, the birth control pill can help to regulate that and reduce some of those symptoms. It can also clear up acne in certain cases, and then of course preventing pregnancy. So the next methods now are preventing the sperm and the egg from coming together in fertilization. So you can think of these as like barrier methods. We have condoms. There's two different types of condoms. The traditional male condoms, what they're called, that go over the penis, and the other ones called female, which are now being renamed as internal condoms. those are put inside the body, the vagina, or elsewhere, and then that kind of covers the penis when it goes into that area. Condoms, if used properly, are fairly effective. You can see here, male condoms more effective than the internal or female condoms are. But they have a wider range. That's because there's a bigger chance for human error here. If a condom is not put on properly, for example, you got to squeeze the air out of the tip of the penis, the tip of the condom before you put it on, or it could have a chance of rupturing when ejaculation happens. The condom must be stored properly. If it's, old and dry and can be brittle, it could, break. If you put on 2 condoms, that could, at the same time, that could create friction that causes actually the condoms to rupture. So proper use and storage and other things relate to a lower overall effectiveness with condoms. Diaphragm or the cervical cap. That's something that's put up. They're similar, kind of different structures, put up to block passage of the sperm further up into the uterus. Oftentimes, those cervical caps or diaphragms aren't used alone. They're used with spermicide, which is a chemical, helps to kill sperm. So in case any sperm swim around that, the spermicide will hopefully kill them. And some condoms also have spermicide inside of them just in case. And then the final method that prevents fertilization are these sterilization procedures. These are highly, highly effective measures. We'll talk about them one at a time on the next couple of slides, but they're less reversible than any of the other things we've talked about. They're, in theory, you can reverse them, but it doesn't always work. So let's talk about these sterilization methods. The male procedure is called a vasectomy. Vasectomy relating to the vas deferens. So what happens is they cut a small incision in the scrotum. They use a hooked tool. They pull out the vas deferens. They cut it and seal it shut. They either tie it shut, burn it shut, some way they make that closed, put it back inside, and stitch that all back up. It's a really fast procedure, minimally invasive, very little risk associated. What happens is that this male will still make sperm. He will still ejaculate. What comes out will still be almost the same amount. But what happens is that sperm that's made gets to a dead end, and it can't go any further. So the body will just break that sperm down and reabsorb it. Same thing with sperm that's inside the epididymis. If a male doesn't release it, it doesn't cause any harm. The body just breaks it down and reabsorbs it. And then what happens is the fluids are added, but there's no sperm there, so semen still comes out, but it just contains no sperm. It's like the male is shooting blanks, right? But the volume is pretty much unchanged because remember, even though there's between 40 to 50 million sperm cells per ejaculate, they're very, very, very small, so they don't take up much volume. The female sterilization procedure is called tubal ligation. You can sometimes hear it referred to as getting your tubes tied. This is a more invasive procedure because the fallopian tubes must be cut and they're deeper inside the body. And so they access those fallopian tubes. They can put a tight band around them, kind of like a belt almost, that can be removed later. Or they can cut them and tie them shut, or cut them and burn them shut. That's cauterized, cut and burn. All of these procedures, including the male procedure, are technically reversible, but a lot of times when they get put back together or you remove the band, you might have some difficulty in sperm and or eggs being able to get through these locations, which could then lead to reduced fertility or infertility in extreme cases. As with the males, with tubal ligation, females still have their normal period. They still have their normal menstrual cycle. Because eggs are getting released from the ovaries, they just get to this end here, and they can't go any further, so that egg gets broken down and reabsorbed from the body, and the lining of the uterus that thickened, that endometrium, gets shed out through the vagina. So highly effective methods, but you really only want to consider them if you're almost positive you don't want to have children, because the reversibility of it is a kind of questionable thing. All right, here's a quick question about something we've talked about so far. So take a minute to pause the video, read through these options, and see what you think. All right, so talking about preventing fertilization, and that would be what we just finished talking about, tubal ligation. These other 3 are all hormone-based methods. They're preventing ovulation from occurring. The only 100% way that you can possibly prevent pregnancy is to not have sex altogether. Okay? And so that's hopefully pretty obvious. We'll talk about some other methods here. Some methods that are called collectively the fertility awareness methods. You may sometimes hear it called natural family planning. And there's two different kind of parts to this: symptom-based methods and calendar-based methods. If you use the calendar-based methods by themselves, it's not very effective, because calendar-based is looking at, when was your last period, and, when are you most likely to be close to ovulation, and then, your next period. But because there's that variability, it's not always 28 days for a menstrual cycle, it's not extremely effective. And also, ovulation doesn't happen necessarily right in the middle. So using these symptom-based methods, maybe in conjunction with the calendar, is more effective. So the symptom-based methods, there's two ones: basal body temperature. Basal you can think of as like basement, the lowest temperature of your body during the day. And that happens when you first wake up. So for this method, you take your temperature right away before you get out of bed. That gives you your basal body temperature. You can see over here that there are some natural fluctuations in it, but it's generally around a certain temperature. However, right around that time of ovulation, there's a pretty big spike, a big change. And that's a sign that ovulation is just about occurring. Additionally, by checking the consistency of the cervical mucus. The cervical mucus is usually fairly thick and the cervix is closed. However, as a woman approaches ovulation, that mucus becomes thinner, wetter, and more of it is produced. And that increases up until just before ovulation. So at peak wetness, where this mucus is very slippery, there's a lot of it being produced, that's a sign that ovulation is right about to occur. So using these things together can help you then figure out when you're likely to be able to get pregnant. And as they always say, there's an app for that. That's true with this as well. You can use apps to track your fertility, either to avoid getting pregnant or to try to get pregnant by planning to have intercourse during those peak fertility times. Other apps, besides just for that, you can use them for maybe predicting your period. Let's say you want to go on a beach trip and you don't want to be there during your period. You can use this to help you predict when your period is going to be next. One thing to point out, though, is that as with any apps, you must use them with caution, because we don't know. Were these apps created by Johns Hopkins University or by an 8-year-old in China, right? So make sure you talk to your doctor first before you have your fertility decisions determined by an app that's of questionable reliability. I'd mentioned before the pull-out or withdrawal method. This is where a man removes the penis prior to ejaculation. And so there's a few reasons why this method is not very reliable. One is that there needs to be a lot of control on the male's side. Some males will overestimate their control and may not withdraw the penis in time or communicate that to their partner, and then ejaculation happens. Also could be that sperm in the pre-ejaculate could lead to pregnancy. So, not the best method overall, but if you use it in conjunction with, say, natural family planning, the fertility awareness methods, together they can be pretty effective. You just not want to then use this method during peak fertility. Douching. If you're not familiar with douching, this is where you take a bottle and you fill it with this fluid and you squirt it up into the vagina to rinse it out. Some companies, like Summer's Eve, would want you to think this is something that you should regularly do. However, you should not. Douching should pretty much never be done unless a doctor has ordered it for a specific reason. And that's because the vagina is an amazing self-cleaning organ. If you squirt stuff up into there, or you wash up inside there with soap, which you also should not do, you're going to disrupt the native bacteria and the environment of that vagina, making it more likely for you to get an infection. It also could push sperm further up from the vagina through the cervix up into the body of the uterus, increasing the chance of pregnancy. So douching should not be done. The last methods here are preventing implantation. An egg has been released. Egg and sperm have come together in fertilization to create an embryo. Embryo is grown into a ball of cells, and now that ball of cells is ready to, or that embryo is ready to implant. So IUDs, both the hormone-based one I talked about earlier and the copper-based one, both of those can also prevent implantation. The copper one only prevents implantation. It does not prevent ovulation. The hormone-based IUD can prevent ovulation and or implantation. And so the IUD, like I said, it gets stuck up inside the uterus and it releases either hormones, or in this case it sheds a small amount of copper to make that environment unsuitable so that the embryo cannot successfully implant. The lining is not thick enough to support that embryo in there. Highly effective. You put it in, you forget about it, or your doctor puts it in, you forget about it. But again, there are some risks associated with it. And then the last option here, morning after pills, also called Plan B is the brand name, emergency contraception, there's other names for this as well. It's like a mega dose of the birth control pill. You can see here it has 50 times more estrogen than the regular birth control pill. It can stop ovum development, so it can prevent actual ovulation as well, or implantation. And you can see here, if it's used within 72 hours of unprotected sex, it can lead to a high chance of preventing pregnancy. But typical use is a little bit lower. So this is a summary slide talking about each of these methods. I do want you to know their comparative effectiveness. You do not need to know the percent numbers, but if you're comparing, say, withdrawal to IUDs, you should know which one's more effective. So I would ask you to compare between these three different categories, 1, 2, and 3. So up here, the most effective are hormone-based methods. So implants, birth control pill, injections, patches, vaginal ring, IUDs, and also then the sterilization procedures. LAM we did not talk about. This is where after a woman gives birth, if she breastfeeds regularly, like every 4 hours, without missing a feeding, it's almost impossible for her to get pregnant. The body will prevent hormones from getting released and prevent ovulation. It's to help her be able to focus on that one baby before having to go through the process and get ready for another one. It gives her body a chance to recover. It's kind of a built-in natural birth control, but have to basically every 4 hours breastfeed. So these are the most effective then. All this category, okay? Second category then are going to be the barrier methods, along with fertility awareness. So diaphragm, cervical cap, condoms, fertility awareness methods, if used properly, these are the second most effective. And then the least effective, withdrawal, douching, or just using spermicide by itself without anything else. And here are some links to some very good websites to review this further, either for your own information or for studying. So I'd encourage you to check those out. 2 different websites here with the QR codes you can scan with your phone camera. All right. Oops, sorry. So this one's asking a question: which method of birth control works exclusively by preventing implantation? And that is the copper IUD. It can prevent implantation, but not ovulation. This one prevents ovulation. This one prevents or can prevent ovulation and implantation. And this one prevents also just ovulation. All right, that finishes up this topic.